So I had a conversation with a professor at the University of Texas who's doing some good work with Black folks with type 2 diabetes. We got on this conversation of if you ever get type 2 diabetes, will you always have it? And she says, of course, you'll always have type 2 diabetes once you have it. Now you might get to a point where you no longer need, insulin medication, or you no longer, have high blood sugars, high A1Cs. Those can be normalized with plant-based diets and the like. Um, you may never need dialysis. You can get to a point where you never need dialysis, where you are losing weight, where you are basically healthy, but the type 2 diabetes will always stay. And I was thinking, like, well, respect to this woman, but that's kind of like saying if you have the flu, once you get the flu, you'll always have the flu. I mean, it's no longer contagious, and you won't need medications, and you won't be sick, and you won't have the symptoms, and you won't have the high temperature, but it's always there. I mean, it seems like you can make that argument for anything. But I think if we ask a type 2 diabetic if it would be all right if their blood sugars were normal and they didn't have to worry about losing their eyes or their limbs, I think they might take that, even if it's not called cured. So, just a thought.